In this latest session on the reproductive system, we're going to have a little look at the male sex act, and obviously after this we'll do another one on the female sex act. Now there's a lot of similarity between the two systems and how they work and the various phases that are involved, but there are also some subtle differences. So, like I said, the first thing we're going to look at is we're only going to summarise the mechanisms underlying the male sex act. So first of all, I kind of want you to think a little bit about what you already know. Now, this might be fairly limited, but I just want you to have a little broad think about what the physiological responses are in each of the various phases of the sex act. So the sexual response cycle has 4 broad physiological phases. So you've got an excitement phase, which is driven by the parasympathetic nervous system, so PNS-induced vasodilation. You have a plateau phase, which is where you have the parasympathetic nervous system building, or maintaining rather, but with the sympathetic nervous system now kicking in. So what is happening during this plateau phase? You've then got the orgasmic phase, where you get the sympathetic nervous system taking over, but also a somatic response. So somatic nervous system is your skeletal nervous system. And then you have resolution phase, which is where you get withdrawal of the parasympathetic nervous system, and basically the sympathetic nervous system has overtaken at this point. So I'd just like you to have a little think about these phases. So you're going to press pause, have a think about it, then we'll go through it. But I think it's also important to remember that as well as these physiological responses, which is what we're thinking about, there are of course emotional, psychological, and sociological factors that are involved. Like I said, we're only thinking about the physiological aspects. A nice way to think about this when you're going through it is the point and shoot kind of analogy, where point is the erection, which is induced by P, so parasympathetic nervous system, and the shoot aspect is the sympathetic nervous system, and so that's orgasm and ejaculation. So those are kind of what the two, an easy way to think about it, point and shoot. So parasympathetic starts it, sympathetic nervous system finishes it. So again, just press pause, have a little bit of a think, and then we shall go through things. Right, so hopefully you've had a bit of a think. So think about the excitement phase. We've got the parasympathetic nervous system dominating, and it's leading to vasodilation. So what is happening? This is just really where you get the parasympathetic nervous system causing vasodilation within the penis, and we'll talk about the areas where that's happening in a second, and leading to heightened sexual awareness. So that is your first phase. The second phase is the plateau phase, and this is where you're getting response intensification. So the parasympathetic nervous system is still active, very, very active, maintaining that vasodilation within the penile arterioles rather, and maintaining that erection. But now you've got the sympathetic tone is beginning to increase gradually. So the heart rate is going up, blood pressure is going up, respiratory rate is going up, and muscle tone or muscle tension are beginning to rise. So in other words, the system is now moving towards sympathetic threshold required for the next phase, which is orgasm. And so orgasm in males obviously occurs with ejaculation of gametes and where you're getting intense physical pleasure. So remember, this is where the sympathetic nervous system threshold has been met. So that's where ejaculation. So that's your point and shoot. So we're now at the shoot aspect of it. And finally, you've got the resolution phase, and this is where the parasympathetic nervous system has been withdrawn and the sympathetic nervous system has taken over. And so we're returning the return of the genitalia and body system to pre-arousal state. But the key thing in males, at least, is that re-arousal is not possible for a particular refractory period. And that refractory period it depends on the individual, but also as you get older, that refractory period gets longer. So in younger people, it's a shorter refractory period before you can continue and start again. But in older individuals, that refractory period tends to take a little bit longer. So Key thing, the erection, so in that initial phase, depends on penile engorgement with blood. So it's nothing to do with muscle, it's all to do with blood. So the penis is mainly made up of erectile tissues with 3 sponge-like vascular blood spaces, and we can see them in this image. So we're looking at the shape of the penis here. You can see the corpus cavernosa, which you can see in these areas, and the corpus spongiosum. And so what would normally happen, these spaces become engorged with blood. So in the absence of sexual excitement, it contains little blood because the arterioles are constricted. Okay, and as they're constricted, less blood is getting in. And so the erection, you get parasympathetic induced blood flow, so vasodilation into these arterioles, and those cavernosas start to fill up with blood and the tissue becomes erect. So the erection depends on blood flow, not on muscle contraction. And so what's actually happening? What's driving this whole process? Remembering that you have both physical and emotional effects. We're not going to dwell on the emotional effects, though they are important. So you get this glans penis mechanoreceptor stimulation. So mechanoreceptors are basically pressure receptors, so you're getting that tactile sensation. That stimulates the sympathetic nervous system, and so it goes through a nice spinal reflex. So you get that stimulation of the penis, that moves, you get this immediate reflex going through the spinal cord. So the sensory input goes to the spinal cord and immediately straight back towards the penis, leading to parasympathetic supply to penile arterioles. Of course, that input is also going up to the central nervous system and up to the brain where you have those feelings of it, those psychological aspects. But a key thing is there's also that spinal reflex, so it happens instantaneously. That is driving the parasympathetic supply to the penile arterioles, which then go to vasodilate, and therefore as they vasodilated, more blood is going into those cavernosa tissues, and the blood is filling up, blood fills the penis erectile tissue. And that, obviously, as you might expect, leads to an erection. Now, it's interesting because this is parasympathetic supply causing vasodilation, and most arterioles only have sympathetic innervation. So this is kind of one of the exceptions to the rule. How does it actually drive this vasodilation? Well, it's by releasing nitric oxide from local endothelial cells. So nitric oxide, you'll know this from other systems, other body systems, for example, within the heart, and those local endothelial cells releasing that nitric oxide causes that vasodilatory effect. So we now know we've got an erection, so the penis is enlarged in length and width, and it's there to become a hardened, elongated organ capable of penetrating the vagina. So, with that vasodilation, that increased blood supply going in, that compresses the veins. So you've got that increased pressure within there. And so thereby compressing the veins, it stops blood leaving the penis, and therefore it remains in the penis, and therefore that helps to potentiate or keep that erection in place. As well as that stimulation causing an erection, it also supplies that parasympathetic supply to the bulbourethral gland. And as you'll know from the structure and the function of the various systems within the male reproductive system, that leads to mucus production and therefore added lubrication. And finally, whilst we're not thinking about it too much, it does have to be kind of mentioned in passing. Those thoughts about sex, that drive, can either have a positive or a negative effect on the central nervous system and therefore that supply. So actually those thoughts have a very large input into the entire process. So, and this leads nicely into a little bit on erectile dysfunction. So this can be down to physical defects. So you may have neuropathy. So for example, in diabetes, there's that peripheral neuropathy, and you may have issues with generating an erection because of that peripheral neuropathy. But it can also be due to psychological factors. So what I'd like you to just have a little think. Again, just have a little bit of a think. Here are your factors that affect an erection. So you've got pharmaceutical, neural, vascular, psychological. And I want you to just have a really crude think about the conditions in each case that can potentially interfere with the generation of an erection in the first place. Okay, so thinking about pharmaceutical, we're not going into too much detail, but there are medications that can disturb normal function, okay, whether that's affecting the nervous system or blood supply. You have neural ones. We've just talked about this, so neuropathy in diabetes, and a common presenting feature in some diabetic patients is they may not know they're diabetic. They go to their GP because they're unable to generate an erection, and they're found to have diabetes, and they've got this peripheral neuropathy, which is affecting those nerve impulses, that sensory nerve input. You have vascular conditions, so hypertension and cardiovascular disease can damage arterioles, therefore preventing full dilation. And of course, psychological, so anxiety can lead to erectile dysfunction. And that then goes on to fuel the anxiety, therefore increasing the problem. So anxiety is a major one because it can, in the first place, can lead to erectile dysfunction, and then because of that nervousness around having sexual intercourse can further cause anxiety, making the whole problem worse and turning it into an entire vicious cycle. And that's where drugs will often come in, such as Viagra. So a key thing about Viagra that you will have heard of, it doesn't actually cause an erection in the first place. Okay, so you need to be able to, or a male needs to be able to generate an erection. What Viagra does, it helps to maintain an erection. So the trigger still needs to be there in the first place. So remember, it's about maintaining rather than generating. And the side effects of Viagra are very limited as the drug concentrates in the penis. So it's very good in that respect. Okay, so that's the erection phase for the very first phase. The next phase is the plateau phase. And this is where the parasympathetic activity keeps the penile blood vessels dilated so that the erection is maintained. But at the same time, sympathetic activity starts to increase the heart rate, starts to increase blood pressure, muscle tension, so muscle contraction, and that pushes more blood into the penis. So you've got the PNS, causing erection to be maintained. You've got that SNS mediated increase in cardiac output and respiratory rate. That leads to increased blood flow to the erectile tissue because remember, your cardiac output is increasing. That increases penis engorgement, and that increased compression of the muscle of the penile veins occurs because of the increased muscle tension. So that's skeletal muscles being contracted and tensed, and therefore compression on the penile veins. And that increased penis engorgement through both parasympathetic and sympathetic increases the penis sensitivity and arousal, and the arousal system now moves towards sympathetic threshold for orgasm to begin. So we now move into the orgasmic phase, and this has two parts to it. The first part is emission, and the second part is expulsion. So the stimuli that induce the erection also cause ejaculation when a critical level of excitement is reached. And the emission phase is driven by the sympathetic nervous system. And so what it does, it constricts it causes a constriction of the ducts so that the semen passes into the urethra via that sympathetic activation. So you get smooth muscle contraction in the prostate, the ducts and the seminal vesicles, and the semen passes nicely into the urethra. The bladder neck also closes to prevent urine mixing. So at this point, the emission, remember, is taking the semen into the urethra. Okay, so it hasn't yet been expulsed, terrible wording, released, and that's the expulsion phase. So the filling of the urethra with the semen triggers nerve impulses that activate the skeletal muscle contractions at the base of the penis. So expulsion is increasing the pressure within the penis, forcibly expelling semen out from the urethra. So you start to get involuntary rhythmic contractions of the pelvic muscles, heavy breathing and tachycardia obviously increase. And so you're getting those strong rhythmic contractions. This leads to ejaculation of semen out through the urethra, and then this is followed by a refractory period. So this refractory period is where you are unable to orgasm again. So in younger males, this is often only a few minutes long, up to 30 minutes long. As people get a little bit older, so into middle age, it's 30 minutes, can be 30 minutes up to several hours. And in older males, it can be many, many hours or even 24 hours or longer later. So it really does change as time progresses. So what's happening? So we've now hit the resolution phase. So this is the last phase, and this is where the parasympathetic nervous system removal reduces the arterial vasodilation. And if you're removing that vasodilation, remember there is less blood in the penis, so it becomes more flaccid. But you've also got the sympathetic nervous system has kicked in, leading to vasoconstriction. Again, closing off that blood supply, leading to a loss of erection and therefore the refractory period. So there are a couple of things going on there. You've got removal of the PNS and activation of the SNS. It's important to realize what orgasm actually is. Orgasm is perception. Ejaculation is the physical event. So they are subtly different. So now we're just onto the summary table. So I'd just like you to just see what you can remember from this very nice short session. So remembering the phases, you've got the excitement phase, which is parasympathetic, which is point. You've got the plateau phase. You've got the orgasm phase, which is broken down into two, emission and expulsion. That's the shoot phase, so sympathetic. And then you've got the resolution phase, which is both parasympathetic and sympathetic. So I'd like you to just think what is happening at each stage as a summary. So again, press pause. Okay, so the first phase is excitement. So that's where you're getting that tactile stimulation, but also that central nervous system input that can influence erection in both a positive and a negative way. And you're getting penile engorgement. So you're getting vasodilation of the arterioles within the penis, allowing blood to engorge or accumulate within them, leading to an erection, which is a longer and wider penis that is hard and erect. You then move into the plateau phase. So this is where the parasympathetic system is maintaining the erection through that engorgement, through that that arterial vasodilation. But you're getting a rising sympathetic response. So you're getting an increased cardiovascular response. So your heart rate, your stroke volume, your cardiac output, your respiratory rate. But you're also building that muscle tension. So you're starting to get contraction of a variety of muscles throughout the body. You then move into the orgasmic phase. And you have two parts of this. One is emission, which is now sympathetic. So you've hit that sympathetic threshold where the semen enters the urethra and the bladder neck closes. And that's you getting contraction of the various ducts and the vesicles within the reproductive system. And then you get orgasm. Second phase, which is this expulsion, which is the somatic, which is skeletal muscle. So at the base of the penis, the skeletal muscle there, which starts to contract, and the semen is expelled. And so that's your expulsion phase. And then finally, once ejaculation has occurred, you moved into the resolution phase where you have a temporary refractory period. And during this, sexual stimulation cannot trigger another erections. Okay, so therefore males cannot experience multiple orgasms within a couple of minutes, as some females sometimes do, because they don't have that refractory period, as we'll think about later. So, resolution, what's happening? Reduced parasympathetic nervous system activity reduces vasodilation, so less blood is going into the penis. The sympathetic nervous system has also obviously been activated, which is driving vasoconstriction, and again leading to a loss of erection and into that refractory period, like I said, where a male cannot trigger another erection until that refractory period has reduced, which, as we've already said, in younger males can only just be a few minutes, middle-aged, a bit longer, up to several hours, and older males even more again. There we go. That is the end. Nice summary, nice and quick. Hope you understand it.